Thank you very much, Dr. Pinn. And wow, have things changed? They even have a podium that fits me. Usually the podiums were for the long and lanky, and Connie knows what I'm talking about. Well, hello everyone, and what a spectacular day this is as we gather for the 20th anniversary of the establishment of the Office of Women's Health Research at NIH. I know it's been a great day of reflection and a look back, but it's going to also continue to be a great day for a look ahead. I loved that letter up there because the day that we wrote it and sent it, we saw it as like the new American Revolution. It was the Declaration of Independence, or as Dr. Healy just reminded me, that when the suffragists met in Seneca Falls, they had their Declaration of Sentiments. And boy, did we have a lot of sentiments about what was going on. It was, at that time, an exciting time, but we knew that women were once again being left out of the work being done at NIH and even in the private sector. And for me, as someone who's a supporter of science and an advocate for women's health, and as a woman, it was very important that we be included. In 1987, I was elected to the United States Senate. I was the first Democratic woman elected in her own right. Other Democratic women had served, but some poor guy, namely their husband, had to die so they could get the job. Women were not only proud of the fact that I won, but men were relieved as well. And when I came to the Senate, I had two new Republican women friends. My very good friend in the Senate, Senator Nancy Kassebaum, a terrific and wonderful person who became a great friend of mine, and the person who got elected in Montgomery County was my new and enduring friend, Connie Morella. So we continued to work because over in the Senate, there were only two women, Senator Kassebaum and I. So we stayed very close with the Congresswoman's Caucus on Women's Issues, which was and continues to be a bipartisan effort. Now, a lot went on and was going on, and as we watched the issue around health, we saw these research studies going on. The famous study, take an aspirin a day, keep a heart attack away. They talked to 10,000 medical residents, all men, not one woman. Or the one on heart disease risk factors, 13,000 men enrolled, but not one woman. Over at the National Institutes of Aging, which is on the Bayview campus in Baltimore, they had a study, a longitudinal one, on the normal processes of aging. They didn't include women. Now, you know, Dick Cheney and I age very differently. So I asked, why weren't they including women? And guess what they told me? They had no women's restrooms in the building. Well, that was the wrong thing to say to me. And I knew that we had a big problem, and we worked together. And what I want to emphasize today is not only our many accomplishments, but the significant thing that I believe made a difference is that we put party aside. We all felt that we were in this together, and we all worked together for change. Doesn't that sound like the right prescription for America, and we don't need more research on that? In 1990, because we do believe in data, asked for a GAO report, and they said women weren't included in the clinical trials. Reaching out to our colleagues, we knew that we wanted to do something. And there was really a stalling of who was going to be head of NIH in that summer of 1990. Our colleagues talked, Pat, Connie, Olympia, and I, And we said, we sent the letter, our declaration of sentiments, our declaration of intent. We said we wanted to meet, and we pulled right on up to the campus. TV cameras, Time magazine. It was before really CNN had come into its own. And just as we pulled up, George Bush the Elder announced Bernadine Healy to be the first woman head of NIH. So we came in, we walked into the building kind of like to the March from Aida, going hoo-ha, hoo-ha, hoo-ha for Bernadine Healy. On that hot August day, thanks to Dr. Raub, who convened the Institute heads, we went around and we talked about what were our goals and our timetables. They knew we were serious. They knew President Bush was serious, and serious scientists wanted to set aside serious stereotypes. What we did was so that NIH could do what they do best, bring out all of the talent in the United States of America. Pursue research where no research has gone before, where there are no barriers, there are no gag rules, that we are unfettered by either politics or stereotypes, that we go for science and let science speak for themselves. We wanted women at the table, included in the research, and we wanted women at the table doing that research. Thanks to the help with Dr. Bernadine Healy, who became the director, we began to pursue that. We then also wanted to codify what we did, and that's when, working together, we established the fact that the Office of Women's Health and Research was both in the federal checkbook, but we also wanted it in the federal law books. And it was then Dr. Healy who appointed Dr. Pinn. You know all of that. What you don't know is all the behind-scenes work. I want to pay tribute and thanks, first of all, to Dr. Ruth Kirstein. We're going to hear a lot about her in a moment or two. But I think Dr. Healy and I would agree, and Connie and so on, as we work together, our forward, our advance, our person on the scene before we showed up was Ruth Kirstein. She was there from the start. She continued to fight alongside of us, and I think we could not have done what we did unless Ruth Kirstein had come before us and did what she did. And I hope we give all honor to her. We also found that there were the great guys that supported us. William Natcher in appropriations, Tom Harkin in appropriations, others from the other party, and we all worked together. And we also all planned to do this. I emphasize this, again, because it was harmony. We wanted to increase the funding for research, and we also wanted to increase inclusion. When we did this, though, I remember Dr. Healy calling me, saying this: I want to do a longitudinal study on hormone replacement. I know Congress doesn't earmark, and we don't want to go there. We agreed on that. And she said, but I can't necessarily go to OMB for this. And I said, well, just talk to me, and let's see where it goes. So we got a sense of that. And I went to Teddy Kennedy, and I went to Tom Harkin, and I said, we don't earmark, but let's put a pot of money into the Office of Women's Health and let NIH decide how to spend it. Well, you know how that went. It changed what we do. And we keep on changing. We keep on working together. Today, there are 17 women in the Senate, 13 Democrats and 4 Republicans. The one issue that brings us together is women's health. We don't have a caucus, but we do get together once a month for dinner. Tomorrow night, we will be gathering, and we're going to be having dinner with the 3 women on the Supreme Court. Not to talk about cases, but to talk about opportunity and where our country is. But also among ourselves, we disagree on the issue of choice. We disagree on the budget. We disagree on offshore drilling. But what we don't disagree on is on women's health. And we have organized to keep this office functioning Working with Senator Snowe and the Republican women, we've expanded that to other inclusion. Last year, when they wanted to take our mammograms away from us, we went to the Senate floor and we introduced the Women's Preventive Health Amendment into the Senate Health Reform Bill. We got that passed to make sure preventive services of all types are available to women, but also to men as well, to make sure that you have the opportunity for those early warning systems to catch those diseases sooner. And working together in that health care bill, we also passed the legislation to end gender discrimination in health care. Women right now pay 40% more than women in the coverage that they got, not with the bill that we passed. And we ended the despicable insurance practice, punitive insurance practices of denying health care to women who had either a premature baby, or 8 states denied health care to women who were victims of domestic violence and called that a pre-existing condition. Well, we linked arms and we changed that. So right now, regardless of what you think of the health care reform bill, just know, because of the women of the Senate coming together, being a woman is no longer a pre-existing condition. And because of the work that we do, we have really made a difference. I recall speaking to Dr. Healy, as we periodically do, when there was a New York Times article that said breast cancer rates in this country had been reduced by 15%. And I called Dr. Healy and said, you see that? That came out of the hormone replacement study. And I said, when the history of this office is written, and they're going to say, well, what did you all really do? And I say, what did we all do? The researchers, the women in politics, the women in policy. Tell them we saved lives, 1 million at a time. So that's what our legacy is, but legacies are meant to be built on. So I would like to close with the words of a very dear friend to the Office of Women's Health, who helped me in the Senate get it started. The very dear words of my friend Ted Kennedy, who is no longer with us, but is still with us in spirit. And you might recall his famous words at a political convention when he said, the work goes on, the cause endures, the hope still lives, and the dream will never die. We've got a lot to do for the next 20 years. And thank you very much. Oh, wow. Oh, look at the standard ovation.